Hello everyone, my name is Midwife Sally. Welcome back to my channel. On my channel, we talk about everything concerning maternal health, pregnancy, labor, and delivery. Yes, I promised you that I was going to interview midwives across the country and probably outside the country. So today, I am here at the Pampram Polyclinic. I'm with no other person, okay, than a special person, okay. So she was the best nurse, regional best nurse for Greater Accra in 2019. She's worked so hard to achieve whatever she has achieved. So today I'm going to have a conversation with her, and I'm sure you are going to love it. Her name is Mrs. Elizabeth Hutchison. I hope I pronounced the name well. Welcome.
Thank you.
Okay, so we are glad to be here.
We are happy to have you.
Yeah, so I'm very happy I'm speaking to the best midwife 2019. How was it feeling like?
It was great.
It was great.
It was great. At least we felt our hard work had paid off.
Your hard work had paid off. Yes, so recognition is good. So we thank God for that. Yeah, so today we are going to take some advice from her. Yes, for a lot of you mothers, you come to me with some questions. Sometimes you tell me, oh, Midwife Sally, the midwife was shouting on me. Midwife Sally, the midwife was like, sometimes the complaints are a lot, and it looks like there's a communication gap between the midwives and the clients. So our topic today is that, what do midwives expect from mothers during labor? Yeah, so my first question is, what is labor?
Okay. So when we talk about labor, let's say it's a process of giving birth. And this process entails a lot of stages. It has about 4 main stages. It starts with when you start feeling your lower abdominal pains or you feel contractions, then your cervix or the opening of your womb starts to dilate. Then this dilation will start up to a point where it will be fully dilated. Then finally, in the final stages, where your baby comes out. So we have the first stage of labor, we have second stage, we have third stage of labor.
Okay.
So first stage basically is from when your contractions begins and your cervix starts dilating till you get to about 10 centimeters dilated. When you are 10 centimeters dilated, then there we say your cervix is now fully dilated. Baby can come out now. So the period between when the baby comes out, fully dilation till baby comes out, we refer to it as second stage.
Second stage, okay.
But once baby that comes out, we don't end there. The afterbirth, or what we call the placenta, must also be delivered. And we also have to control bleeding. So that is our third stage. Then the final stage is the fourth stage, when after everything we have to monitor baby and mother to ensure that everything is fine. Mother is not bleeding, baby is well. So basically that is labor.
Thank you so much. So how long does the fourth stage, because we all know, I keep mentioning it, 3 stages. So she has told us that there's a fourth stage. How long does it last, and how important is that stage?
Okay. So for the fourth stage of labor, we are basically looking at within the first 1 hour after birth.
Okay.
Then within the first 1 hour after birth, the care we give to the woman during that period, we normally refer to as the fourth stage.
Okay. So at that time, what should the mother report to the midwife about?
So at the fourth stage, normally we tell the mother you can urinate more frequently. We teach them how to feel the hardened uterus or the contracted uterus. So then, after we have taught the woman, if she feels it and she realizes that no, it is a bit softer than what we thought, she's prone to bleeding, so she has to inform the midwife about it. Or she notices she's bleeding, she has to inform the midwife about it. Baby is not suckling well, or baby is not breathing well. Midwives will check all these, but at times, because of the heavy load on midwives, some of these things we teach our mothers to also help us with it, or they are with the babies and they may notice some of these things earlier than.
Okay. Wow, that's great. So what she's saying is that the fourth stage is very important. At that time, You have to learn how to massage your uterus. You have to report if you are bleeding or you have any concerns. You tell the midwife. So that is great. We move on to the main topic now. Yes. So when a woman comes to the hospital, how should she prepare before she gets into the labor ward? I think the problem starts from the preparation. So how should a woman be ready before she gets into the labor ward, the D-Day?
Okay. So, sorry, I have a bit of kata. I'll be fine. So, for labor, as I've already said, it's a beautiful experience. It's a wonderful experience. However, it's painful. But the pain doesn't deter us from doing what is right. At the end of the day, there's so much joy after the little pain we go through.
Yeah.
So before labor, we normally advise the woman to prepare adequately. Some of the preparations, which we normally term as preparation for confinement, it's like you are going on a journey. Whether it's a day or two, you are coming to the labor ward. This process, you need a sound mind to go through. So first of all, we advise our women to make sure your home is well put in place.
So their own homes?
Yes.
Okay, fair.
Before you come to the labor ward, maybe you have a kid already. Maybe you have a husband, you have other people, other needs to attend to at home. And I'm leaving these people for a day to be in labor. If I don't make sure things are well put in place, I'll be here and I'll be thinking about them. And that may not help with the process of labor. So we advise that you get a support person. If it's your mom, your husband, a cousin, whoever, tell them about preparations you are making. Maybe this is my EDD, but as we normally know, you may deliver earlier, 2 weeks earlier or 2 weeks after your EDD. But around that period, you get somebody. So my auntie, my husband, my mommy, I'll be going in labor. These other kids, this is their work schedule, this is their school time schedule. So you have arranged all these things. You have adequate food for them at home. You know, mommy will be picking them up from school, or daddy will be picking them up from school. So then when you are away, you are okay. The other things you need to do is that when you have your own means of transport, even if you have your own means of transport, it's necessary you get an extra means of transport. Reason being that maybe when you are in labor, you cannot drive yourself.
Okay.
Then we can't tell what might be happening to your husband. Maybe your husband will be with you. You may say, oh, my husband can drive me. But that very day, things can change. So we normally advise that you get an extra means of transport. Okay. So that in case labor sets in, and our cars too can also be faulty at any given point. Yes. But if we have a plan B available, then we are rest for sure things will go smooth. But at times, issues come in when we get into labor, my car is not starting. I don't have any other person to fall on. So I'll be roaming before you realize I have delivered at home. You bleed and other complications setting. And that is what we try as much as possible to prevent. So those are some of the things you have to do. Aside that too, we are welcoming a new baby into the world. We need little items for the baby. The baby's dress, call sheets, diapers and other things. You have to arrange them nicely. You, the mother too, as you are coming, you need at least your dresses, you wear a little food. Normally we recommend beverages, so you keep little beverages in your bag. Add a little money. Make sure you have health insurance. If you are not on any, it's good you have. If you don't have, then we advise you get a little money aside so that when you are coming, you know, as I'm going on this journey, I'm prepared. Like we are all traveling to Accra or I'm going elsewhere. At least if you have things well put in place, we are fine.
Okay, that's great. So you mentioned that they should prepare the home, they should transportation, and also they should make sure that their items are set.
Yes.
Okay, so that's the summary of that. So now let's come to the labor ward, the D-Day. Yes. So how do the midwives expect the women to cooperate, or like what do you expect from them when they come and they are in labor?
We advise our women thank you for that question. We advise them when you come in labor, as I've already said, in as much as it is painful, we need oxytocin, which we normally call the love hormone, to work. So then first of all, I want you to have a sound mind. do away with all fears. Be confident in yourself, knowing that I'll be able to go through this. And once you are with that, at least much of the problem is solved.
So psychological preparation.
Yes. So you should be psychologically prepared to go through labor. If you are psychologically prepared, oxytocin, which is a love hormone, or the hormones which helps your uterus to contract, more messages will be sent to your brain, more oxytocin will be produced, your labor will progress normally. But once we have a disturbed mind, then we have an issue there. So that's about our psychological preparation. Then also we advise that the midwives are your friends. When you are in labor, try as much as possible to communicate your feelings with your midwife.
Okay, so speaking with your midwife.
Yes.
Okay.
You should tell your midwife whatever you are going through. Maybe, Madam Midwife, this pain is so much unbearable. Can I have some pain medications? We try as much as possible to give pain medications. However, if you have come and we have given and it is not adequate, nothing prevents you from communicating with your midwife. Or midwife, I feel now my water has broken. No, I can see something like blood. Anything at all which is happening to you, please communicate with your midwife. That will also help a lot. Another thing we advise is you should try and walk about. We don't normally advise you come in labor and you sleep in one place.
Okay, let me ask a question here. They have been saying that when your waters have broken, you can't walk around. Is there anything like that?
Yes. Normally when you come and there is no contraindication or there is no reason why you can walk about, we allow you. However, when your waters break, at times we advise that as much as possible you limit the movement. Reason being that when the waters break and your cervix has fully not dilated, your baby's head has not descended or has not come very down to your vaginal area or your pelvic area, you realize that the baby's cord can easily slip through.
Oh, okay.
And once that happens, we have an emergency to deal with. So, in as much as we want you to try and walk about, when your waters break, you find your midwife telling you, please try and lie on your side. Okay. And preferably, most of the times, we advise you lie on your left side so that we will get more oxygen to your baby.
Okay. Okay.
Then another preparation too you have to make is we try as much as possible to eat. During labor, we are not advising you take heavy meals.
Okay.
Reason being that a labor might be progressing normally, but at a point in time, things may change and we may need an emergency anesthesia. And you are lying on your back, you may throw up, and the dangers of you aspirating is high. So we normally advise you don't take heavy meals, but we still encourage you to take in something. You can take a lot of fluids, beverages, things to keep you strong.
Okay. So
those are the things we advise. We also advise you try and empty your bladder as much as you can. Urinate more frequently. When you urinate more frequently, what happens is that your bladder, which lies in front of your womb, once it is empty, your womb can contract more, then the labor progresses. But once your bladder or the thing which stores urine is full, what happens is that your uterus cannot get enough room to contract, so the labor may prolong. So we advise you urinate more frequently. If for a reason you cannot, please inform your midwives. They will help you out in that situation. Okay. Then also, one of the things we also advise is we beg our women as much as possible to try and cooperate with the midwives. We know labor is painful.
That's the difficult part.
Yes, we know labor is painful. We do our best to give you some pain medications. But there are some too, when the contractions comes, some of our women may end up shouting. It is good to shout, fine. But if we do it so much, we become exhausted. And it is when we get to the second stage, that's when the cervix is fully dilated and your baby is about to come. You may need more energy to push. But by then you might have shouted so much, you become exhausted. Then now you cannot push. Then we are putting baby's life at risk. So we advise that you try as much as possible to cooperate with the midwives. We will also try our very best to help you go through this experience wonderfully. Then finally, another preparation we are expecting is that your maternal effort, when we get to our second stage and we have to push, please, we know it is painful, and that is the most painful part when the baby is coming out. But looking at all our 9 months journey and all the suffering we have suffered, it is just a period of maximum 1 hour, which most people don't even get there. So we try as much as possible to put in your very best to push. Your midwives are always there to support you to go through. Then also we advise you get your partners around. If the worst situation permits it, we'll allow them in. They being around will give you maximum help. At least if you are going through pain and you get somebody to share your pain with, it's much easier than you going through alone. So when the worst situations allow and your partner is there, I keep saying when the worst situation allow, because in some settings you have a single room for yourself, your partner can be with you. In other settings you may have an open ward, and if you have other mothers in labor, then it may be difficult. But even with that, we are trying as much as possible to provide secure privacy for you if your partner is around. So basically, I may say, for us to have our labor without much complications, these are most of the things we expect from our mothers.
Okay, so those are great points. Cooperate with your midwife and all that, and you have the best labor. I want to ask some of the questions that pregnant women ask, or they do. That sometimes, is it okay that they put their hand, like you see that sometimes they'll put, that is one of the things that sometimes it does happen, and there's discomfort for the nurse and the midwife. The woman puts the hand in the vagina, and then maybe without even cleaning again, she's in pain the next time and she's trying to touch the midwife, and the midwife is screaming, coming. So at that time, it feels like the woman feels that the midwife is being disrespectful or rejecting her, and the midwife is also feeling that the woman is not doing the right thing. So how should that be? How should we go about that?
Okay, thank you. So in the first place, we advise that when you are in labor, try as much as possible not to be putting your hands in there. Reason being that because of the pain you are going through, you are touching a lot of things, and putting your hands in there, we are introducing infection. Once you are in labor, our cervix has dilated. Anything you put, the infections can go up. It can go and affect our babies, or our babies will be born. These things are down there, they come with their face down. So at the end of the day, what happens? We may have our baby's eyes discharging and other things we don't want to happen to our baby. So we pray as much as possible, we don't put our hands in there. Then if for any reason you have to put your hands in there, I know at times going through the pain you want to hold somebody, but the midwives are like that because at times we are attending to so many other clients. Maybe we have 3 or 4 women in labor, so I put my hand in there, whatever is there I pick. You hold the midwife with it, she goes to client B, the client B too holds her. So at the end of the day, in as much as we want to protect you, the client, yourself, because if client B holds me with an infected hand, you hold me with it, whatever she might have, you may pick it up.
Do the same thing
again, then you are picking up infections you need not have. So we want to prevent the client from taking infections home as much as protect our midwives too, because we also need to stay strong to be able to look after you. So if for any reason any midwife spoke in that manner, or you touch a midwife and the midwife was like, oh please don't touch me, we'll try as much as possible, but the main reasons are this. So let's try. We the midwives on our part too, we try to know how to handle such situations. Thank you.
Okay, but it's okay for a client to hold the midwife for support. It's only uncomfortable when the woman puts her hand there and then tries to.
Yes, very well. You can hold your midwife for support. If your midwives, at times when the ward is less busy, maybe you are the only laboring woman and there is a midwife and she stands by, you can hold her, you can call her, auntie midwife, help me do this. We are there to support you. That's the main message I want us to carry across. We are there to support you. We are your friends. We started the journey with you, so we wish to go through with you.
Okay. Yeah, so it's becoming interesting, but our time too. So let me go to the next question, then we'll wrap up. Yeah, so there's this misconception that a lot of people, I have seen that I walked into the labor ward in my hospital, and there was a woman who was rubbing her own back, and another woman shouted at her, Madam Jai, because if you don't stop that, you are going to your baby's eyes, or there was some myth about it. How true is that?
Please, as you said, it's a myth that when you are going through labor and somebody rubs your back, your babies come out and you see flashes on their faces. It is a myth. And I guess maybe somebody did not, maybe coincidentally, somebody was rubbing the back, delivered the baby with flashes on the face, and we ended up saying no, it's because they rubbed the back. But at times, the process of labor alone is that when you have a baby who is a bit big, passing through that birth canal and the baby comes, you see some of the babies with those bruises on their faces. Some babies too come with their face, like they are delivered with their face, yes, face presentation. So with such babies, you see those bruises on their face. So it's not because of the sacral massage or the massage they give at the back. That massage actually is good to help it.
Helpful.
Yes, it's helpful when you are laboring. At least it suits your pain a bit. So we even encourage it. If your partner is around, whoever is around, can help you with that sacral massage.
Yeah, so please, between contractions, how should a woman behave?
So
or what should they do between contractions? The contractions are coming, it's so tough. Like,
so when you are getting contractions, we most of the times, and this education starts right from antenatally, we advise you to do deep breathing exercise, or you take in deep breaths. You find the midwife tell you, breathe in, then out. So it's like try to take in deep breaths when the contractions are coming. When it lessens, then you release. When it comes, you take deep breath and you release. That's one to help you manage the pain better.
Okay, great. Yeah, so the final question is that we know that labor is difficult, and you know, I am on social media. Anytime you open the floodgates, it is not easy. Like they really give it to us as midwives. So I don't want us to feel like we are being biased. We've talked about what the patients should do a lot. Like, what advice do you give to midwives to when women are in labor? What kind of support should we give them, or how should we behave towards them?
For our midwives, what I would say is, I know the work is stressful, but it is our call to duty, and we are there to support these women throughout. So when they come, we should try as much as possible, no matter our situations, no matter the bad day you've had. Once you are at work, let's try as much as possible to give them the maximum help they need. Let's encourage them. Provide them with all the support they will need and all the help they will need. And our labor will be stress-free. Our women will be happy. Our maternal deaths will be reduced. So that is my advice for our midwives.
Thank you so much. Your final words.
Final words, I will say, like I started, labor is a beautiful experience. It's a wonderful experience. However, it is painful. Midwives are there to support their clients throughout labor. When you come in labor, we expect you to cooperate with your midwives, and we will give you the maximum help you need. At the end of the day, you go home with a healthy baby and a happy family. Thank you so much.
Thank you too. We are glad to have you. We'll be having other topics, so please stay on the channel. Get subscribed. Yeah, so my name is Midwife Sally. Thank you for watching. Have a great day.
Thank you.